what is cancer? That will also be shared today. Coronavirus and its impact on cancer. Also, what are, how are blood cancers diagnosed? How are the cancer types, how are other cancer types diagnosed? And what are the preventative treatments of cancer? And then there'll be a conclusion and an opportunity for you to, inshallah, do any question and answers towards the end. Thank you so much. Okay. So a little bit about World Cancer Day itself. It's an annual event to inform the general public on how cancer is detected. It also acts to educate how cancer can be prevented and treated. With World Cancer Day, it's a global movement with anything. It's important for us to raise awareness in our communities. Unfortunately, this is something that a lot of us will be affected by, if not directly, but somebody we know, somebody, from our family, from our friends or our social circle. It's the big C word that unfortunately exists, but, there's a lot of information that inshallah we will share to benefit, our community with. So Macmillan Cancer Support is, of course, an organisation which I'm sure everyone has heard about, the coffee mornings that happen in September. It's a very big organisation, and in 2018 they'd reached 6.7 million people and supported that many people. The organisation supports cancer patients and their families, and community members throughout the UK with information, training, advice, and all the research studies as well. They are the leading experts in achieving the holistic needs of cancer patients in the UK. So we have actually got a fundraising page. We thought, we'll take this opportunity to do some fundraising for them as well, so we can be part of that support for Macmillan Cancer Support clients. So there's a link at the bottom, www.justgiving.com /fundraising/FST and HYP for Macmillan on World Cancer Day. I know it's quite long, but inshallah you'll find it. And if you can take this opportunity to just donate a little bit, I think every bit helps, and alhamdulillah we try our best to support these type of initiatives as well. So the next slide I think we can have. So this is about HPY. So Dr. Wesam, if you could tell us a little bit about HPY and the projects for 2020 and 2021.
Thank you, Shreen, for the excellent introduction. So Health Professionals for Yemen is a group and a team of healthcare professionals from across the UK. We have a wide range of educational and career backgrounds. We have many doctors, nurses, even pharmacists and dentists. Our mission is to support the health system in Yemen. Many of you will know that there is a civil war in Yemen for about 6 years now. That has created the worst humanitarian crisis. The health system is basically ruined. What we are trying to do is to improve the patient experience by education, training, and international collaboration. We have done quite a few projects. One of them is the medical education course in southern Yemen with charity clinics. We have also managed to spread the leaflets and information about the COVID pandemic in some areas in Yemen. And also we have a telemedicine program and online training for doctors in Aden. We welcome any support to our cause, and you can find more information about us on our website, which is hpyyemen.com, and we have also an email contact there.
Brilliant. The next slide, Sister Hafsa, if you could tell us a little bit about Farah Saeed Trust and how you've got involved with this. Sister Hafsa?
Hello, can you hear me?
Yes.
Okay, brilliant. Good evening, everyone. My name is Hafsa, and I'm one of the volunteers of the Farah Saeed Trust. It's a non-profit organisation named after a dear friend, Dr. Farah Saeed, who was diagnosed with gastric metastatic cancer in March 2014 at the age of 27 and passed away on 8th of September 2014. We have a series of different programs that aims to educate, inspire, and help within our own abilities. Amongst them are humanitarian aid, community and talents, health and education, and also faith-based programs too. So please do visit our website, get in touch if you'd like to get involved, and we'd love to hear from you.
Thank you, Sister Hafsa. Next slide, please.
Yeah.
Right. So this is over to Dr. Wesam. Can you tell us about coronavirus and how it's impacted on cancer, and what can cancer patients do if they think they might have COVID?
Yeah, so coronavirus and cancer. So the way coronavirus has affected cancer is mainly if you look at cancer patients who are going to have chemotherapy or who are on chemotherapy. These patients are usually immunocompromised. It means their immune system is slightly impaired because of cancer or chemotherapy. These patients are at risk of contracting coronavirus, and if they have it, then they will have more severe symptoms. So we generally advise, if the patient has a high temperature and he has cancer or he's on chemotherapy, or if they have persistent cough, or if they have change in the taste or smell or shortness of breath, then either they contact directly their team or their specialist. The other option is to call NHS 111, which is the number used for queries, and if there's it's currently used also for COVID. If the patient is very unwell or the symptoms getting worse, they can call 999. The next slide is about how corona can affect cancer in general, not just cancer patient. And there are two ways of looking at it. One is delaying in the diagnosis, as many patients will delay reporting their symptoms because of the pandemic. They probably don't think it's that important given the current crisis. The other thing that many of the hospitals and healthcare facilities have delayed screening programs and surveillance tests. That's because of the emergency need to treat COVID patients. Also, there's a recent study that showed that death rates are increased, likely also to increase with the corona on the long term. This is an estimate study that's showing about 9% increase in death rate for breast cancer, and also about 15% for colorectal cancer, 5% for lung cancer, and 6% for neck cancer. Thank you.
I think if we can have the next slide, please. Right, so what exactly is cancer? I think Sister Hafsa will be sharing this slide.
Thanks, Shreen. So what is cancer? Many of us have heard of the term cancer. So what is it exactly? So cancer is actually a disease where an abnormal cell divides in an uncontrollable way. In other words, without control. And it initiates at the site of origin, known as the primary tumor, and it can metastasize and spread to healthy organs to form a secondary tumor. And this can be achieved through by the blood and also the lymph vessels. And there are more than 200 types of cancer that are diagnosed and treated in a particular way. So amongst the types of cancer are carcinomas. So these are cancers that affect the skin and tissues that cover internal organs. You can also have in situ. So when there's an abnormal mass tissue called a neoplasm, and it's located within the same area. There's also sarcoma. So sarcoma are cancers of the connective and supportive tissue. For example, the bones, the blood vessels, the fats, cartilage. So an example of a cartilage can be found within the kneecap. Other types of cancers, example, leukemia, so that affect the white blood cells, lymphoma, and also myeloma. So myeloma is derived or caused by abnormal production of plasma cells, which is a type of white blood cell. And it's used to make immunoglobulin to help protect the body from infection. And you could also have cancers of the brain and spinal cord. So there's a variety of different types of cancers. Now, according to Cancer Research UK statistics, it's approximately 367,000 cancer cases between the duration of 2015 to 2017. There's also approximately 165,000 cancer deaths between 2015 and 2017. However, the cancer deaths can be deducted or decreased when it's been diagnosed much earlier to be able to provide the necessary or a personalized treatment in place. Thank you.
Okay, so next.
Sarah, how is cancer diagnosed? So some cancers can be detected through self-examination, such as the breast for any abnormal lumps. It can also be diagnosed through screening. Now, within the UK, we have 3 NHS national screening programs, such as we've got the bowel, the breast cancer, and the cervical cancer. And it can also be caused by coincidentally as a result of other medical conditions. So, for example, patients with breast cancer have an increased risk of getting ovarian cancer, so cancer of the ovaries. In addition, if a patient was smoking heavily and end up developing emphysema and or other lung conditions, they have a potential to also get lung cancer. So the first stage in how cancer is diagnosed is through physical examination. So that consists of signs and symptoms. So what the actual patient actually feels or experiences. This is then followed by a complete medical history. So this consists of, for example, what medications the patient actually has. Is there any hereditary? So in other words, is there any family members have had that? Do they have any medical conditions, etc.? You can also, following this step, there's laboratory studies on the stool, urine, and the blood. So you have some proteins that have an increased level in the blood, and we call them biomarkers. So if there's, for example, say 125, if there's an increase of that biomarker, that can suggest a ovarian. You can also have the sputum, so that is mucus from the lung. So to be able to diagnose lung cancer. And there are a variety of different types of imagings, such as X-ray, CT, MRI. So MRI is a combination of radiation with magnets linked to a computer. Other examples of imaging is ultrasound, endoscopy to determine the location and the size. And the cancer can be confirmed through a biopsy, so the removal of a tissue to detect the cancer cells under microscopy. And the different types of cancers have different types of biopsies. So for example, in the breast cancer, the first node that has been affected is called the sentinel node. So you could have a biopsy from there. And if it's, for example, lung cancer, a biopsy can be taken from an area called the subclavicular fossa. So there's different ways in how biopsy can be taken. If the cancer is negative, but symptoms do continue, then further tests are required. On the other hand, if the cancer is present, other tests and examinations are done to specify the cancer. So this involves the stage and the grade to personalize the treatment. So what I mean by the actual staging is, for example, the tumor node metastasis staging, the TNM. So how big the cancer is and has it spread. So the T is for tumor size, and it's graded between 1 to 4, and 4 being the largest. You can also have the node, which is the for the N, and this is whether the cancer has spread. Hello?
Need more food? I'm going to make salmon, spinach.
Okay, so Sister Hafsa, if you continue, I think I'll, if we could just mute the guests who are joining, Sister Arzak, thank you.
Okay, no worries. So as I was saying, if it's for nodes, so has the cancer spread to the lymph nodes, so that's graded between 0 to 3, and for M is metastasis, has the cancer spread to other organs, so metastasis, so this is between 0 to 1. For example, if for if there is a normal cancer and it has not spread, then that would be, for example, T2, N1, M0. However, if the cancer has been advanced, i.e. spreaded, then it would be T4, N3, M1. There's different ways in how cancer can be diagnosed, and the earlier the cancer that is detected, the more treatment options can be available. Thank you. Now, cancer waiting times is one of the ways
Sorry, Sister Hafsa, if you could just, I think everyone's just been muted. So Sister Hafsa, if you could take that slide again. So tell us more about the cancer waiting times, please.
Hi there, everyone. Can you hear me?
Yes, you're back on. Thank you.
No problem. So cancer waiting time is one of the ways in how NHS aims to refer patients with cancer symptoms much early, and also to improve the survival rates. So it consists of the 2 weeks urgent referral from the GP to the cancer specialist as part of the faster diagnosis standard. And the 31-day rate by NHS varies depending on the region. So in terms of NHS England, the patient should receive the first cancer treatment within 31 days of diagnosis, and the agreed treatment is in place. However, other areas such as Northern Ireland, Wales and Scotland have not set this time frame or target. There's also the 62-day, which is a 2-month, wait by the NHS England between the referral for suspected cancer and the start of treatment. There are other types of ways in how early diagnosis can also be established, and that is through rapid diagnostic centres. So this has been founded by the Cancer Research UK as well as Macmillan, and it aims to support and identify the cancer. So this involves referral times, being able to assess the signs and the symptoms, be able to conduct the necessary testing, the diagnosis, the necessary referral and treatment. There's also another program called Be Clear on Cancer. So this involves the Public Health England and the Department of Health, and it aims to improve the awareness of the signs and symptoms and encourage patients to visit their GP. So overall, there are different ways in how the NHS aims to improve and speed up the diagnosis, and this in turn can decrease the variation, decrease the changes, and be able to decrease the symptoms, i.e. the remission, the tumor size, and prevent the return of cancer, which is known as the relapse. Thank you.
So Dr. Wesam, if you could tell us a bit more about blood cancers.
Yeah, thank you, Shreen. So blood cancers, they form an important part of cancer in general. It is estimated that about 1 in 19 will have blood cancer during their lifetime. That reflects to about 350,000 in every 65 million population. They will be diagnosed with the blood cancer. It's certainly the most common cancer in children from newborn to the age of 14. The most common cancers in such age group is leukemia and brain cancers. And if we divide this group to male and female, then lymphoma will be the most common one in males and kidney cancer in females. There are many types of blood cancers, and the three most common ones are leukemia, lymphoma, and myeloma. How these cancers present can be different from between each type. So leukemia can present with fatigue, tiredness, which is long-standing, loss of appetite, weight loss, sometimes gum bleed, or generalized body ache. Lymphoma can present with lump, like that lump we see in this picture in the neck. Sometimes also lumps in the armpit or the groins. And sometimes it can be found when we do a CT scan looking for causes of weight loss or change of bowel habits, for example. Myeloma is slightly different in the way it presents. It's usually inside the bone in the marrow, and it expands and can cause lesions like holes in the bone. So many patients, they can present with back pain, which is long-standing, and again, sometimes anemia. Next slide. So how we diagnose blood cancers? The first test we do is a blood test, and that will tell us if the patient is anemic, and will also tell us about the other type of cells in the blood, like the white cells, if they are very high or very low. It will tell us also about the platelets, and these are very tiny cells in the blood that help us to clot. Hence, if they are very low, some patients, they can present with extensive bruises or bleeding symptoms. Once we do that, we do also a blood film. We take a drop of this blood and we put it on a slide, and we look under the microscopes, basically trying to find the cells of leukemia or lymphoma. And we do sometimes do a bone marrow biopsy. The factory of the red cells, the white cells, is inside the marrow. So we do sometimes go with the needle under local anesthetic. We do it from the hip bone, as the picture there. And we take a sample of the marrow. And again, we do spread that on a slides and then look at it under the microscope and trying to identify which type of cancer. And if a patient presents with a lymph node enlargement, then we certainly take a biopsy, more or less like the solid tumors that Hafsa mentioned. Thank you.
Thank you, Dr. Wesam. So, as earlier mentioned, there are a variety of different types of cancers, but the main types of cancer that we are focusing within this presentation today is actually breast cancer, lung cancer, bowel cancer, and prostate cancer. So breast cancer is the most common type of cancer in the UK. And it is estimated that 1 in 8 women over the age of 50 are diagnosed with breast cancer. But young women can also have it. And there are a number of risk factors or causal factors that can lead to breast cancer diagnosis. So the first type is, for example, genetics. Now, genes are sequences of chemicals called nucleotides. And what these nucleotide sequences do, they make up the amino acids. And the amino acids are like the building blocks that make up protein. It's just basically bricks that, like analogy is like bricks that make up a house. And in turn, it produces a protein and a variety of different functions of proteins. So you can find it, for example, in the hair, the nails, immunoglobulins and antibodies to prevent infection. You can also have them as hormones. So insulin, example is a peptide hormone. They're also involved in movement. For example, you've got actin and myosin. So these are examples of proteins too. So proteins have a variety of a number of functions within the human body. And there are two main types of genes. So you have the tumor suppressor genes. So the normal function of a tumor suppressor genes is to prevent the tumor from progressing. However, when there is a loss of function, i.e. the gene has been mutated, in other words, there's a change in the sequence. For example, if there's an insertion, or if there's a substitution, or if there's a deletion, and this can overall have an impact on how the protein works. And an example of this is P53, known as the guardian of the genome. There's also RB gene that can cause retinoblastoma. Another type of gene is called a proto-oncogenes. And what they do, they actually increase the progression of cancer. An example of this would be RAS. There's also other types of genes that involve the DNA repair, such as ATM. However, the genes that are involved in causing breast cancer, examples are, for example, 5 to 10% of breast cancers are BRCA1, BRCA2. Some genes involved within breast cancer diagnosis is P53. So these are different types of genes involved in breast cancer diagnosis. Other risk factors, for example, overweight. So if the diet involves a lot of fat intake, that can also lead to breast cancer. Drinking alcohol. If the patient had a previous lump or breast cancer. Also, age is a factor as well. So if the patient, for example, has reached menopause, they are at risk of getting breast cancer and also have an increased risk of getting ovarian cancer. So there's a number of different risk factors involved in breast cancer. And there are two main types of breast cancers. So we have the non-invasive, so the carcinoma in situ. As you can see from the diagram here, the duct, so it's found within the duct, but it's not spread. And according to statistics, it's 90% of the breast cancer diagnosis is the DCIS, so the ductal carcinoma of in situ. However, they have the ability to progress and become invasive, which is the other main type of breast cancer. So they can spread to around the tissue. Examples include they can spread to the bone, to the lung, to the liver, on the skin and central nervous system. Key examples of invasive are, for example, estrogen receptor, so the ER positive. You have also HER2, triple negative breast cancer. However, with the triple negative breast cancer, it doesn't involve the estrogen receptor or the HER2, but it does commonly involve BRCA1 gene being involved, and also of expression of the protein EGFR. So there's different causes within there. So at first, it's, for example, if the person has any symptoms such as swelling or lump within the armpits, any rash or change in appearance of the nipple, such as the size or the shape. Dimpling is, for example, inflammation. So there's like red rash within the area. So then it's advised the patient to book an appointment with the GP, and the GP will then examine the breast and be able to refer the patient to a breast cancer specialist for further testing. And further testing involves a mammography and biopsy. So mammography is done during the breast cancer screening program. So patients between the age of 50 to 70-year-old are invited for breast cancer screening every 3 years. However, the NHS are in process of changing it between 47 to 73, just because there have been some case studies where patients below, slightly below the range and slightly above the range have been diagnosed with breast cancer. And this in turn is one of the ways in how you can increase survival rates, is basically to participate in the breast cancer screening program. Thank you. Now, regards to lung cancer. So lung cancer can start in the windpipe. So this is the tube that connects from the nasal cavity all the way to the lungs with the airway passages, or it can initiate in the tissue. So every year, it's estimated around 47,000 people are diagnosed with lung cancer in the UK, and 4 out of 10 are aged 75 and above. Now, smoking is one of the main risk factors of lung cancer. And it's dependent on the amount of years, the age, and the type of cigarette being smoked. And there are 2 main types of lung cancer. So we have the non-small cell lung cancer, NSCLC, and this affects the neuroendocrine cells of the lung, where it's subdivided to the squamous. So the squamous are thin, flat cells on the surface. And you can also have the adenocarcinoma, so within the mucous gland, and it can also occur within the different parts of the lungs. And another type is the large cell. The other main type of lung cancer is small cell lung cancer, and it spreads faster than the NSCLC. And it's important to state that there are other risk factors besides smoking. So for people who work within the industry, particularly occupations where they inhale or breathe in a lot of chemicals, such as asbestos, radon gas, aromatic hydrocarbons. So when the patient actually inhales these, that also increases the risk of lung cancer. And in a matter of fact, even if the patient does not smoke, but they live with individuals who do smoke, this is known as passive smoking, or work with those who do, they can easily have a slight risk of getting lung cancer too. There have also been cases of genes involved that can lead to lung cancer diagnosis. And these examples include, for example, overexpression of EGFR, RAS, P53, and VEGF. So there are a number of genes involved here too. Thank you. Now, diagnosis of lung cancer consists of a number of steps. So in comparison to breast cancer, where you actually do have signs and symptoms and you can self-examine yourself before booking an appointment with a GP, With lung cancer, symptoms are not normally present, but they gradually occur. So, for example, examples of symptoms include tiredness, a lot of coughing. They can also cough up blood, difficulty breathing, and also weight loss. And there are a variety of different lung cancer markers that can be found overexpressed within the blood tests. Imaging studies can be done, such as X-ray, CT, MRI, PET. So PET is where, for example, there's a small amount of radioactive glucose and it's injected into the vein. So it's been entered within the vein. And then you'll be able to scan and see the images. Other key steps within the diagnosis of lung cancer is biopsy. And as earlier mentioned, in terms of the amount of genes involved within lung cancer diagnosis, genetic testing can also be done. And finally, T&M staging, just to express of how big the cancer is and how far it's spread. Thank you. With regards to bowel cancer, so in reference here, we have two types of bowels. So the large bowel is the large intestine, which we are discussing here. And we also have the small bowel, which is the small intestine. Now, the small intestine is involved in how large food molecules are being broken down into smaller molecules, and then they enter the blood through a process called absorption. However, with the large intestine, which what we're discussing here, they are more involved in how water is being absorbed and how, with all respect, feces or poo is being formed. And there are it's the fourth most common type of cancer globally, and there are a number of genes involved. For example, you have the FAP, so the familial adenomatous polyposis. Also, there has been studies that have shown that exercise is involved with causing large cancer of the large intestine, the alcohol intake as well. So there's a variety of different causes of large bowel cancer. And there are a number of tests that can be done to be able to diagnose this. For example, you have the liver function test, the CEA. And following GP referral, there are two tests done by the specialist team, such as the colonoscopy and the sigmoidoscopy. So you can see within the image here that the colonoscope goes throughout the large intestine. However, in relation to sigmoidoscopy, sigmoidoscopy, it only reaches to the sigmoid area of the large intestine. So there's different types of examinations done to be where there's a camera being attached. However, with sigmoidoscopy, you can take biopsies too. Urgent referrals for bowel obstruction, a 3D scan can be performed, and also MRI. And bowel cancer, it also has a screening program where patients age 55 and above are invited to actually conduct a bowel cancer screening. So there's two types you may have come across. So we have the FIT, which is the fecal immunochemical testing, and you have the fecal occult blood. And the aim of this is to collect the stool, so i.e. from the back passage, and to be able to see whether there's any blood present. Now, the difference between the FIT and the FOB is that with the FIT, you only require one sample. However, with the FOB, you would require three samples taken at different times. And if you require further information in regards to how different types of cancer diagnosis, not only limited to the four which I'm covering, and blood cancer, which Dr. Wesam is covering, and other types of cancers, please do visit, Macmillan, NHS, and the Cancer Research UK website that provide valuable information for the public. Next slide, please. So with regards to prostate cancer, so prostate cancer commonly affects men in the UK, particularly those aged 50 and above. And amongst the symptoms experienced are, for example, a large prostate, and that can affect the urine production, so how much urine is being produced. Sometimes you don't want to go to the toilet, but you have that kind of sensation where you want to go to the toilet, and also there's difficulty urinating, so it affects how the urine is being removed from the body. And there are a number of different risk factors. So we've got the African Caribbean race. According to studies, all men are at risk, but particularly races are also have increased risk. Family history as well, and being obese. There's also studies have shown that 5 to 10% of cases have BRCA1 and BRCA2 genes involved in how prostate cancer can be diagnosed. In terms of how prostate cancer is diagnosed, you have a number of different tests. So for the blood test, commonly it's prostate-specific antigen, PSA, and normally if it's above 4 microgram per liter, then that would require, indicate prostate cancer and require further testing. You can also have the digital rectal examination, DRE. So this is a physical examination where they would be able to feel it. And there are 2 main types of prostate cancer. So you have the neuroendocrine, and you also have the transitional cell. And with regards to prostate cancer, earlier I mentioned in terms of T&M staging. So that's in terms of the key standard in how majority of cancers are actually diagnosed. However, in relation to prostate cancer, they have a particular grading known as the Gleason score. And when it's, for example, if there's a low grade, they would have a 6, and it means there's a small growth within the defined region. However, if it's high grade, then it would give a score of 8 to 10. That means that it will affect the bladder. So bladder is the organ where urine is stored. So after, for example, the large intestine, where the water is absorbed and feces are produced, the feces or the poo, with all respects, is then stored within the rectum. So that's how prostate cancer can also progress over there too. So yeah, so it's important that you are aware of the signs and the symptoms. The aim, or as part of the World Cancer Day, is just to bring awareness, bring alert into the signs and symptoms, so then necessary steps can be performed. Please do not ignore these signs or symptoms. It's better to get checked or visit your GP and do the necessary testing, and then be able to conduct the treatment. And I hope you have benefited in terms of the different types of cancers covered, such as the prostate, the bowel, the breast cancer, and lung cancer. Next slide, please.
Yeah. Thank you,
So,
Hafsa. It's a what cancer treatment. I mean, the patient journey starts from having symptoms and then diagnosing the cancer, and then staging the cancer. And at some stage, they will have a discussion with their specialist about the treatment options. So when it comes to cancer, the treatment options involve surgery, chemotherapy, radiotherapy, and sometimes targeted therapy, or a combination of surgery and chemotherapy or targeted therapy. The important bit is that when it comes to solid cancers like breast and lung, and also some bowel cancers, if they present early, then surgery will be the recommended approach in general. And it usually has a better outcome for patient and also less side effects. If the stage of the disease is what we call it late stage, then the role of the surgery is less, and many patients will have chemotherapy. But it's not uncommon at all to have a combination of both, like surgery with chemotherapy or chemotherapy followed by radiotherapy. The other important evolving field with treatment of cancer is what we call a targeted therapy. In many cases, it's a form of antibody that targets a certain receptor on the cancer cells. This is an important field now, because it has proven to be very beneficial to cancer patient in the way it reduces the side effects. As with chemotherapy, it will kill the cancer cells, but also the good cells, and it comes with many side effects. However, the targeted therapy in general, they have less side effects, and they're very good in targeting the cancer cells. And there is a lot of investment and research going on. So my feeling that the future will be for targeted therapy on the long term. It's also worth mentioning that not all types of cancer need treatment. There are some type of cancers that they are indolent and they don't progress over a long period of time, like some types of lymphomas and some types of prostate cancer. So these patients, sometimes they can be monitored rather than being treated. So there is also scope for some types of cancer to be monitored rather than being treated. Next slide. So prevention of cancer is very important, and prevention is a key. The main important way of trying to prevent cancers is to participate in the screening programs. Hafsa did mention some of the screening programs in her slides. One important thing is also to look at the cervical smears, for example. That can pick up early changes and enable the doctors to intervene in an early stage before even the cancer develops. Some other screening programs like checking PSA, which is a blood test for prostate cancer. So it's important to participate in screening programs, and we'll encourage everyone to do that, especially when it comes to the right age group. Also mammograms. Hafsa did mention about smoking and the relation with the lung cancer. So definitely by stopping smoking, you reduce your risk of having lung cancer. Again, reducing the alcohol intake or stopping it will reduce the risk of having many types of cancer, and also an important cancer like liver cancer. Sunscreens reduce the risk of skin cancer. There are HPV vaccine, which is offered to even students in secondary schools now, reduce the risk of cervical cancer. Exercise, gentle walking can help. Also swimming is a very good, excellent sport. Managing stress by either socializing with family, meditation, and spiritual prayers, they proven to help with cancer. Also complementary therapy, like hypnotherapy. Healthy diet is very important, especially eating vegetables, fruits, less meat. That can help the risk, reducing the risk of cancer. Next slide. So we're coming to the end of this webinar, and the message me and Hafsa would like to come across, and we stress on the importance of screening programs and detecting cancer early. This webinar is meant to be for the public, and we encourage you all to participate in screening programs. I hope through the webinar you have seen the impact of the cancer on patient, how is it diagnosed, what tests we use for it, and the possible treatment. And we hope also that you've seen the impact of coronavirus. And I think in the next few years, we'll see more and more negative impact of corona on cancer patients, especially with the new mutations. Also, we'll appreciate if you can support our fundraising for the World Cancer Day by supporting Macmillan Cancer Support. Their role and input for our patients with cancer is very invaluable. And thank you all for attending this webinar.
Thank you so much, Dr. Wesam and Dr. Hafsa. You know, it's been a very informative webinar. Actually, I've learned a lot myself, and I hope, inshallah, everybody else who's taken part has you know, learned a lot. There are a couple of questions actually that we will just share with you, and maybe you or Hafsa can respond. But a big thank you to everyone who listened. Thank you again to Sister Hafsa and Dr. Wesam who put this you know, this presentation together for you. My name's Shreen Mahmood. You can follow me at just Shreen on Instagram as well. And of course, Macmillan Cancer Support is the organisation that we're supporting for World Cancer Day. And the link is just at the bottom. If anybody would like to donate, please feel welcome to. All of this information, along with a slide and a feedback form, will be emailed to everybody who registered via the Eventbrite link, inshallah. So please look out for that. If there are any other questions, feel free to just drop them in the chat box next to us. And I think, thank you, Sister Erzak, for managing the screen share at the back. It's always great to have some tech support in the background. So the first question that we've got, if Dr. Wesam and Dr. Hafsa want to put their videos back on, please. So the first question we have is, can one avoid having a mastectomy? Is there alternative therapies like going through a good naturopath, or is chemo the main answer?
Who would Wesam, would you like to answer it, or shall I answer it?
Yeah, I think I'll deal with the blood cancers if I can, within my
No
specialty.
Okay, so with breast cancer, there's a number of ways it can be treated. So it can be through chemotherapy. So if it's been diagnosed earlier, so if it's been detected much earlier, then there's a variety of chemotherapies that can be used. You can also have, for example, hormonal therapy, monoclonal antibodies, for example, cetuximab. There's also radiotherapy. So in terms of mastectomy, so mastectomy is only being performed, for example, if the cancer can be you know, removed much easily. However, if it's more advanced, what is being commonly done is to actually undergo chemotherapy to actually shrink the size before being able to undergo, for example, bilateral subcutaneous mastectomy, for example, so or any other prophylactic surgery. So there's a variety of different ways in how it can be treated. And it also depends on the cause. So if it's a HER2 positive receptor, or if it's an estrogen, if it's caused by an estrogen, then a hormonal replacement therapy can be performed. But in terms of lifestyle factors, as what Dr. Wesam advised, doing enough exercise, eating the correct food. For example, alcohol intake, and also smoking. So there's different ways. And also, if, for example, a patient has been diagnosed with breast cancer, it's advised to for the family to actually undergo genetic testing, just in case if it's hereditary. And so if they have a risk of getting, for example, breast cancer, then a treatment or a management plan can be put in place. I hope that answers your question.
Thank you so much, Dr. Hafsa, honestly. So we've got one other question, and maybe Dr. Wesam can answer this one. Cancer is on the rise in adults and children. It's becoming so common and it's so scary that anyone can get it these days. It wasn't as common in the last generation. Why is this?
This is a very straightforward question, but the answer is not straightforward, to be honest. You can make lectures about why the cancer is probably more prevalent now than before. Many ways. First, we have, like at least in UK, an aging population. So we know that cancer is common in older people. And the better health service, the longer the people live, and then they have more cancer. But it just doesn't involve one thing that caused cancer to increase. There are many factors there. Environmental factors, pollution. The food we eat now is not the same food we used to eat like 50 years ago. What is now organic food used to be the normal one. All these chemicals, the pollution in the air. So these all the factors, but also our immune system plays a big part in it. So we have cancer cells in our body, they circulate, but our immune system is good in getting rid of them. So if there is anything that can cause reduced immunity, then the cancer will have a chance to spread and increase in size or number. But again, the cancer is mutating, it's changing. So that's why it's a challenge. If it was just a straightforward one, we would have been able to get rid of it long time ago. But the better we get in the treatment, it starts changing and mutating and becoming more resistant. So there are many, many factors to that. And I don't think anyone will be able to say, this is the reason that why cancer is more than we have it before. The other thing we need to remember, are we really better in diagnosing it now? So, like 50 years ago or something, many people or patients would have died because of cancer, and we wouldn't have known that they died because of cancer. So part of the increased rate of cancer is because we're better in diagnosing it and treating it. So it's not a straightforward answer. I don't think there is one answer which will tell you, oh, this is the reason. There are more than one thing.
Sure. Thank you so much, Dr. Wesam. Another question that came in, will there be a talk on ovarian cancer next time? Sister Hafsa, Dr. Hafsa, will there be a talk on ovarian cancer, or is there something you can share with us quickly?
In terms for ovarian cancer, but as part of the feedback form, we do have, for example, future topics they would, the participants in attendance would like us to cover. So, I mean, with any, subject that the attendees are interested in, we'll try our best or collaborate with other professionals and organize a webinar for this. So why not? Thank you for the suggestion.
Thank you so much. And last question is, are all types of cancer hereditary?
I can answer that. I think that's probably a straightforward answer. No. Most of blood cancers are not hereditary. And I'm sure many of the other solid tumors, they are not hereditary. There are some types of cancer that are hereditary, but no, the straightforward answer is no.
Okay, thank you. Sisters and brothers who have joined us today, thank you again, for joining us and taking part in this webinar. If there are any questions, you've literally got maybe a minute or two to answer. This is your last chance. And I think, like we mentioned at the beginning of this webinar, it's so important for us to spread awareness about these type of things, and that's why these types of days are so important. World Cancer Day gives you a chance to go and do some research, and actually, unfortunately, like we've mentioned, it is it's usually the case that we know someone or someone who has cancer, some sort of cancer. So it's very important for you to take this information and inshallah encourage other people to learn about it as well. If there's any general advice or that's been given here, please remember to talk to your own GPs and your own health professionals, get in touch with them as well. But everyone's details are here. If you want to contact Sister Hafsa, Dr. Hafsa and Dr. Wesam, please just respond back to the email. You will be receiving an email with the slides and a feedback form. Please do remember to take some time out to fill that in as well. I think that's it. I think everyone's given thank yous. And other than that, I think we make a dua, we make a prayer for everyone who has been affected by cancer. May Allah subhanahu wa ta'ala make it easy for you and your families. And inshallah, the support is there either through Macmillan Support Cancer and organizations such as, our sisters, Farah Saeed Trust as well, and Health Professionals Yemen. But a big thank you to everyone who's joined. I think Sister Hafsa, is it okay to conclude now and say Assalamu alaikum?
Yeah.
Any last messages?
I would like to thank everyone who's been involved in organising the webinar, and those who made the effort to actually attend. And we hope me and Dr. Wesam had just given you an introduction or some awareness of how different types of cancers can be diagnosed, different symptoms. So don't ignore any symptom that you may feel, especially if it's occurred over a period of time or ongoing. Please do visit your GP, and we hope we've achieved our objective for today, and have a nice evening.
Okay, take care everybody, and God bless. Assalamu alaikum.
Thank you, Shreen.